Welcome to our podcast, The Better You Are, The Better You Are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us. The better you are.
Our speakers today include Dr. Regina Adair. Dr. Adair is the Regional Medical Director for TeamHealth's OB-GYN Hospitalist Northeast and Indiana markets. She is also the Facility Medical Director for the Indiana University Ball Memorial OB-GYN Hospitalist Program. She has more than 20 years of experience in the field of obstetrics and gynecology. Next is Dr. Ann Matory. Dr. Matory is a neonatologist with 40 years of experience, having worked in neonatal intensive care units in Chicago, Atlanta, and now in Indianapolis. She is currently the medical director of the neonatal intensive care unit at Eskenazi Hospital in Indianapolis, Indiana, and is also a faculty attending physician at Riley Hospital Neonatal Intensive Care Unit. We also have Sierra Woods. Sierra is a postpartum registered nurse, international board certified lactation consultant, postpartum doula, and an Indiana certified community health worker. She is founder of the Melamama Maternal Wellness Program in Indianapolis, Indiana, focused on providing accessible lactation care for women of color and underserved communities. We also have Dr. Ann Osuntokun. Dr. Osuntokun is a pediatrician with 27 years experience. She is with Peyton Manning Children's Hospital and the Ascension Medical Group in Indiana and has been with them for the past 21 years. She takes care of children from birth to young adulthood at the age of 21. We also have Dr. Tamika Dawson. Dr. Dawson is a highly experienced family and sports medicine physician based in Indianapolis, Indiana. She also has some 20 years of experience and is a course director at the Indiana University School of Medicine. And I am Dr. Lauren Dungy-Poythress. I am a maternal-fetal medicine specialist, which means that I specialize in high-risk obstetrics, and I have decades of experience as well and have worked with different programs throughout my career, including here in Indiana, as well as other states. What I love about this panel is that it includes people and professions that I would reach out to in order to help care for women throughout a pregnancy. Okay, we talked about a whole lot of things. Let's talk about the importance of fathers. Fathers are often there. Fathers are often supportive for their wife, but oftentimes ignored, particularly if there's a complication of pregnancy. I know that I'm often guilty of it. I'm talking to the mom. I tried to include the father because they're a parent too. They hurt too. They often don't know how to express it or how best to support their spouse or partner in these situations. So what's some advice we can give to fathers when they present for OB visits with their patient? I'll start with you, Dr. Adair.
So for my fathers, I want them to be just as involved as mom. I incorporate them in all of the visits, and they are crucial in the success of the pregnancy. The studies have shown that when mom has a supportive partner and a stable relationship, that the pregnancy outcomes are better. So if they're in a good place with their husband, then the pregnancy likely will have a good outcome. And when I was in the office and in practice, I'm like, hey, wonderful. This is the best time for everybody. And I sat down and I talked about how important it was for him to understand that there are hormonal changes that go on and mood swings, and to give grace and understanding, and that being able to communicate with his wife that, hey, I feel left out, I feel on the sideline, so that she can understand what she needs to do to help more incorporate him in the events. And at the prenatal visits, I might even let them help find the baby. At some deliveries, I would allow for them to deliver the baby if they so, I always have them cut the umbilical cord if they don't pass out, even in a C-section. So in C-sections, because it's sterile, the fathers can't be as involved, but I always leave it, the umbilical cord a little longer so that when the baby's on the warmer, the dad can still cut it so they feel involved. And then, just offering them support and asking questions about, hey, do you have any concerns that you're aware of? If they have preeclampsia or diabetes, they can be instrumental in helping moms do better during the pregnancy with their diet and exercise and taking meds.
And, I have to laugh because sometimes I have, friends in church or whatever, and it's their first pregnancy, and they either ask for advice or I give them my advice. This is my advice to them, particularly around 34 weeks. Everybody's tired of being pregnant. You need to compliment your wife, or, you need to say you look good because nothing fits right. You're not sleeping well. You don't feel good. So you want to be supportive in that regard and doing extra things. And yeah, I'm a little grumpy because I haven't slept well, for a little while. And it doesn't look like I'm going to sleep well for a little while longer. So there are ways to be supportive. And it's important to know that that's just a normal part of pregnancy. People say, oh, pregnancy, best time of your life. Well, not really. Maybe there's a 2-week window in there where everything's really nice, but you're nauseous and vomiting in the first part and you're just uncomfortable, sleep deprived, can't sleep at night and have to go to the bathroom every 20 minutes. And so things can be complicated. I know in the NICU, there can be, complications. Both parents can be stressed, and talk about no control of the situation. So I know it can be challenging. What advice do you have for dads?
As you mentioned also when you were talking about interacting with the mom more so than dad, perhaps, we have to work really hard to not just focus on talking to mom when we're talking about the baby. Dad is in the room, but we just get so accustomed. So we work really hard to include both in the discussions, in the conversations. And I always encourage parents, when they leave the hospital or when I've left the room, to write down their questions, because oftentimes they'll think of questions after I left the room or after we've had conversations, or they're at home in the middle of the night. And I encourage dad to be the one, maybe the scribe, to write down those questions that they can bring back to us the next day when they visit. You're right. There are complications in the NICU. If a baby is in a NICU, number one, something didn't go as planned. And so we try to prepare parents for that ahead of time. If we know, for example, there is an anomaly, there is some abnormal development in the fetus that's going to require the baby to come to the NICU, we talk with them before mom delivers. And we give them an outline of who will be at the delivery from our team, the things we'll probably have to do for the baby, and then when we're going to have to transfer the baby to the NICU. But much of that conversation is with dad, because oftentimes mom is laboring, she's not feeling like having conversation, and so we can have those discussion points with dad. He then can help mom understand, perhaps after the fact, when we're working with the baby, he can then explain that this was something they told me about before the baby was delivered to expect, and that's what's happening. We'll still go back and talk to mom, of course, but dad can start that conversation sometimes when we're working with the baby.
And you brought to mind for me that sometimes I have complicated patients where I say, we're going to need to deliver this baby early for this reason or whatever. We ought to consider this. And I remember distinctly one situation with a dad who he kept fussing with me and argumentative, and it finally came out what he was concerned about. And I spent an hour, which is a lengthy period of time in a clinic, going back and forth, letting them sit there, coming back, trying to understand what is the real problem. And he finally said, I know somebody who had a baby early, and that baby died because it was born early, my advice to dads would be, and I said, if you say that to your doctor or say that to me, it took a long time to get to what I really need to talk to you about. And sometimes that can be hard for dads. They're scared too. They're hurting too. It's not just the mom. And for us as care providers to understand that, but also what might help me as a care provider. So my advice to dads would be, try to let go of the the macho
Bravado.
and say, here's what I'm really concerned about. Here's what I'm scared about, or here's what this is what I'm worried about. And we're going to help you through that. So what advice would you have for dads?
So I would say this is in postpartum, right? Or
Anytime.
prenatal? Okay.
Anytime.
So I would say from my own perspective with my husband, with my first son, his thing was always he wanted to do nighttime things. So when it came to bath time, he was in charge of that. So I knew after I feed my baby, I basically got about 3 hours where I was just like free time. Where I'm like, I'm gonna go take a bath. I'm gonna go read a book. That was always my time. And to this day, like my oldest is 7. That's still his thing. Like bath time, nighttime routine is his thing. Like they did bath, they did reading, he did bedtime. Like that was it. So I would say get more involved in like find their own niche of like what they want to do with that child. And now my kids always think like, oh, it's time to go to bed. Now, daddy got to read us a book because mommy's going to do her own thing now.
Excellent. What thoughts or advice might you have regarding dads?
So during the initial visit, when you're choosing your pediatrician, I always encourage the mom, if she comes in alone, most of the time I will have both parents there. If she comes in alone, I will say to her, do you want dad to be part of this visit? I would do FaceTime with him as well. So I'll have her put him on the phone and we will just talk and ask questions. And that just it sows the seed of you're important in this process. And most of the moms will say, yeah, you do that. I'll say, yeah, sure. She'll get him on the phone. Put what you're doing now. I need the doctor wants to talk to you. So then we will have a conversation. Also, once the baby is born, I always encourage the feed-in, that midnight feed-in, that 11 o'clock feed-in. I always say to dad, maybe make that your feed-in. So mom gets the extra time she needs to rest. And at the same time, you get your bonding time. So those are the two that I will usually recommend for the parent. And what I do when they come for their well visits, which as we talked about, that is pretty often, I will say at the end of the visit, if dad is present, I will say, I will make my eye contact to dad because I know a lot of the time mom is the one that has the list and she's the one talking. I would turn to dad and I would say, Dad, do you have any questions? And then all of a sudden it's like, oh, me? Yeah, yeah. Oh, yeah. Then he will say his question. So it just lets him know that you are important in this and I'm involving both of you in this process. And I find that helps out a lot to let dad know that he's valued and that part of a child's life would always be a father. And this is not always the dad that's the husband. Sometimes it's just the partner. Sometimes the dad is not even involved in the life of the child. And if that happens, I will ask the mom that, does his dad, I know he's not with you, but is he part of your child's life? And if mom says, yeah, he's part of it, he's just, I'll say, put him on the phone. We will talk to him together and we'll just welcome him into this conversation.
Nice. What about you?
I think the biggest thing the advice I would give dads is you're there. So you can see your spouse, your significant other, and what they're going through. And so what you'll notice is that they're going through postpartum depression before anyone else will. And so the number of patients who have come because their spouse or their significant other has told them, hey, you're not well, you're not mentally well, is amazing. And they'll come in and they'll cry and they'll be like, I just thought it was baby blues. But the mood changes that was significant that they kind of brushed off because, oh, it'll get better, hadn't gotten better. They saw their OB, oh, I'm fine, I'm good. But then their significant other's like, no, you're not okay, you're not good. And so I've seen that more than I've seen anything else. And on the flip side of that, I think dads do tend to feel insignificant, but they have a major role. My husband was one that actually caught my postpartum depression with my second child. And I was crying in an airport because he was like, you're not okay. And I was like, I wasn't okay, but I didn't see it. We kind of talked about, you just kind of go through the motions. You're working, you're doing. And I was just doing what I always do, but I had brushed it under the rug. And so I think dads are super important for the care of not only the baby, but the care of their significant other and spouse as well.
So the baby's in the womb, the baby can hear, the baby's going to gravitate towards what they know most. But also, then that might be something to talk about, that dads can talk to the baby.
Yes.
And maybe you want to talk about that, Dr.
So babies can hear and they have senses in the womb. And so dads can have interactions with the baby that the babies will remember. Inherently, God in his infinite wisdom, in order for babies to survive, they needed to know their mom. They needed to know the mom's smell. They heard her heartbeat their whole lives. And so that's what's the most comforting for the baby initially. But there are studies that show that dads who talk or sing to their baby regularly while they're in the womb, when the baby comes out, if they do that same thing, the baby will turn their heads, snuggle, do things like that. So dads can establish bonding well before the babies are born.
I distinctly remember a delivery I did as a resident where the baby was crying in the isolette that they put the baby in after delivered, and the pediatric care providers are washing the baby off and everything and crying, and the dad went over and just talked, and the baby quieted and turned its head like, I know you, I know that voice. And that was very special to me. So.
You can also, as we talked about it, about making sure that dad is involved in the feed-in. And I think the dad having his own personal time with his child, with mom not present in the room. So that's why I would always advise, just go to your room, watch, is it Housewives or something that is silly that you can watch on TV that is just a no-brainer, and take your mind off that and just let dad have his moment. And sometimes that creates that bond that, that is, we know naturally a child would gravitate to the person who is the mother. We know that. But we can also create that bond with the father by having that experience that is external without mom being present in the room.
Seeing the skin is really important too for dads to just have your shirt off, have the baby naked with a diaper on, and have the baby just on your skin, and just talking, singing to the baby, those type of things, that will really calm a baby as well.
Okay, well, that's just some thoughts and advice we have for dads who are very important to this whole pregnancy issue as well, before, during, and after. The better you are, the better you are.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.